Hello everyone, Assalamu alaikum. I am Dr. Mohsin Malik and I am consultant plastic and cosmetic surgeon. Today we will talk about the most important body contouring procedure in plastic surgery that is nowadays more in demand or in fashion, that is mommy makeover. We will talk about what is mommy makeover, what is the ideal time to proceed this surgery, who is the ideal candidate, what consultations patient required before surgeries. We will talk about procedure, complication, result and post care. First of all, what is mommy makeover? Due to advancement in medical facilities and plastic surgeries, nowadays mothers are more concerned about their physical fitness, shape of the body, especially abdomen and breast. Pregnancy and multiple C-sections in female life leaves lots of changes on the human body, and abdomen and breast are most commonly affected parts of the female body due to these two reasons. Because it leads to extra skin, stretch marks, extra fat and hanging abdomen. And similarly, there is ptosis of the breast, enlargement of the breast and destruction of size and shape of the breast. So the mommy makeover is a procedure that we can execute to reshape the female body as it was in pre-pregnancy state. So this is not a scientific term, but it is the combination of surgeries. Most commonly it includes tummy tuck or abdominoplasty with breast reduction or breast lift, or mastopexy with augmentations. Breast procedure is decided on the basis of physical examinations and patient consent. What is the ideal time for this procedure? In this regards, we are concerned about two things. One, the lactating status of mother, whether she is breastfeeding or not. Secondly, whether she has completed her family or not. So this procedure we normally prefer and advise the patient once she had completed families and almost 12 months after her last child. We will not advise in lactating mother. So if we talk about consultations before surgery, then physical examination, consultation with the patient and consent. These are four main pillars. In history, we will ask about patient concern, expectations, their priority level, previous surgeries, and any history of hernia or any other comorbidity disease like hypertension. We categorize the sizes of the breast, also assess the shape of the breast, size of the breast, hanging abdomen, and after that we consult with the patient what is the desire of the patient, and we will discuss about where will be the scar and what is post care, what are the complications of the procedures. After discussing all these things, we will proceed toward the surgical procedures. After completion of the consultation with the patient, anesthesia evaluation and medical fitness, and discussing about patient concern and expectations, we can proceed toward the surgery. The surgical procedure is carried in supine position in general anesthesia and takes almost 4 hours. In abdominoplasty, we do 4 changes in the body. Extra skin and fat is excised, belly button is repositioned, and the rectus muscle is plicated, and so it gives a best look to the belt line or waist lines, and sometimes we need liposuction over the love handles or in the area of thigh if there is only extra fat. Similarly, if we talk about the breast, we will carry the procedures either what the patient needs, either reduction or mastopexy. We will proceed it accordingly to make the breast shape more and aesthetically pleasant for the patient. And the scar for the abdominoplasty is in the bikini line, that is camouflaged and in hidden places. And after the surgery, we advise patient abdominal belt and rest for next 1 day. On the second day, patients can walk slowly, and all the strenuous activities like gym and are prohibited until 4 to 6 weeks. We advise patient the soft diet and complete bed rest for the next 2 or 3 weeks. What are the complications of these procedures? Bleeding, infection, hematoma, seroma, and hypertrophic scarring are the some complications of this procedure. And in long term, in case of breast asymmetry. But if the patient is selected properly and it is done by the certified experienced plastic surgeon, there are less chances of getting these complications. The results are long lasting if you maintain your stable weight and you will not plan next pregnancy. Then you can enjoy the results of these procedures up to 10 to 15 years. So permanent results. So it has many advantages like same anesthesia, a short recovery time, and it is also cost effective because all these procedures are done by a single anesthesia and one-time hospital stay. So these are the advantage of these procedures. If you have any further queries regarding these procedures, you can subscribe our channel, you can mail us, and you can contact us on this number. Thank you very much.